I had to pay a huge amount from my pocket after one of my inpatient stays of 2 nights because my stay was not considered required, even though I was in severe pain at the time of admission. I also had a very good healthcare benefit coverage plan in place. Still, I had to pay a huge amount from my pocket. Had I known little about utilization management and its purpose, I would have been more careful before considering admission into the hospital. Hi, I'm Manmeet Chadha. Welcome to Health Tech Decoded, where you get answers to all your queries related to healthcare technologies. Here we are talking about utilization management and why you should be aware of this healthcare evaluation process. Utilization management became more prevalent in the 1980s because healthcare costs in the United States started to rise significantly than they had in the past few decades. This was now the most effective and efficient way to control the healthcare costs and reduce claim denials. But how exactly it controls costs and reduces denials? Let's understand utilization management closely. But before that, please don't forget to like and subscribe the channel. So now let's talk about what exactly utilization management is and how it is used by insurance agencies and the payers. UM is nothing but techniques that are used to manage healthcare costs. It also includes procedures that are used to conduct reviews. And these procedures, they fall in three categories: prospective, concurrent, and retrospective. So I will just now take you through these procedures also in detail. For now, let's talk about why do we need UM. It's required for evaluating the efficiency, appropriateness, and necessity of the treatments that doctors have proposed to patients. How is this evaluation done? Let's talk about that now. So, it uses some guidelines that are based on evidences that are collected from the past patient reviews. That's how it's used. Whom exactly does address? It addresses patients who seek inpatient admissions or any kind of new clinical activity. It also influences the decisions that are taken for patient care. Because utilization management is an evaluation process, this evaluation can happen during any stage of the treatment, either when the treatment is being planned, or while in the middle of the treatment, or even after the treatment is complete. Based on when the evaluation is happening, utilization management reviews are of three types. So now I'll take you through all the three types of utilization management reviews. So the three types of procedures that are used for reviews are prospective, concurrent, and retrospective. Prospective review, which is also called as the pre-authorization review, it happens before any treatment begins. It involves analyzing the proposed treatment. The main use of prospective review is elimination of unneeded or duplicate treatments. It's also called as pre-authorization, as we've discussed. And this review is never required for emergency admissions. Now, concurrent review, it happens after the treatment has begun, usually within 24 to 72 hours of admission. It analyzes the treatments that are ongoing, and this review includes coordination about the care being provided to the patient. And it also reviews the transitions if required. So, for example, if the transition from ICU to the room has to happen, that's when it keeps a check on. It also keeps a check on the discharge planning. Now, the retrospective review, this review happens after the treatment is complete. It analyzes the appropriateness, effectiveness, and timings of the completed treatments. This review is required for handling the reimbursements of claims or for any type of claim denials. With such retrospective reviews, the UMO is actually able to collect evidence that can be used in future for other reviews. Now that you have an idea of the three review types of utilization management, let's understand who exactly does these reviews and who controls these review techniques. It's done by an organization which is called as the Utilization Management Organization, also called UMO many times. Let's understand this better. So UMO or Utilization Management Org, it's controlled by payers or insurance providers. It involves many reviewers, nurses, healthcare specialists, and even independent organizations are part of this team. And the main focus of this team is to manage costs and quality of healthcare services. So now that you get an idea of the utilization management, let me also clarify to you that what all healthcare services are evaluated by the UMO reviewers as part of the utilization management process. So the various services evaluated by UMO, they include inpatient admissions, whether required or not required, days for the inpatient stay, admissions to skilled nursing facilities, again, the days for SNF inpatient stay. They also evaluate home visits, whether required or not. Then, even some type of outpatient visits are evaluated by UMO. They include certain high cost imagings or even referrals to the specialists. Hope you get a better idea about the utilization management and how it benefits us. For more detailed information on how the entire healthcare ecosystem works, do check out this video and don't forget to subscribe to the channel Health Tech Decoded.